I hate commuting to the city. I hate commuting to the city.
Hello YouTube, it's Holy Joe Rock and Roll coming to you live and unscripted. And I'm wearing this tuxedo jacket for a reason. More on that later. I've been hesitant to weigh in on the Obamacare fiasco. But I have to just give you some of my opinions because what happened today just blew my mind. Mr. Obama, Mr. President, you are a big liar. Okay? And let's play this clip. Watch this clip.
It is also true that some Americans who have health insurance plans that they bought on their own through the old individual market are getting notices from their insurance companies suggesting that somehow because of the Affordable Care Act, they may be losing their existing health insurance plans. This has been the latest flurry in the news. Because there's been a lot of confusion and misinformation about this, I want to explain just what's going on. One of the things health reform was designed to do was to help not only the uninsured, but also the underinsured. And there are a number of Americans, fewer than 5% of Americans, who've got cut-rate plans that don't offer real financial protection in the event of a serious illness or an accident. Remember, before the Affordable Care Act, these bad apple insurers had free rein every single year to limit the care that you received or use minor pre-existing conditions to jack up your premiums or bill you into bankruptcy. So a lot of people thought they were buying coverage, and it turned out not to be so good. Before the Affordable Care Act, the worst of these plans routinely dropped thousands of Americans every single year. And on average, premiums for folks who stayed in their plans for more than a year shot up about 15% a year. This wasn't just bad for those folks who had these policies. It was bad for all of us. Because, again, when tragedy strikes and folks can't pay their medical bills, everybody else picks up the tab. Now, if you had one of these substandard plans before the Affordable Care Act became law, and you really liked that plan, you were able to keep it. That's what I said when I was running for office. That was part of the promise we made. But ever since the law was passed, if insurers decided to downgrade or cancel these substandard plans, what we said under the law is you've got to replace them with quality comprehensive coverage. Because that too was a central premise of the Affordable Care Act from the very beginning. And today that promise means that every plan in the marketplace covers a core set of minimum benefits like maternity care and preventive care and mental health care and prescription drug benefits and hospitalization. And they can't use allergies or pregnancy or a sports injury or the fact that you're a woman to charge you more. They can't do that anymore. They can't do that anymore.
Okay, did you hear what he just said? That is a total lie, a total contradiction to what he promised. He didn't say you can keep your health care law, you can keep your health care if you like it until we pass the Obamacare law. No, that's not what he said. What he said was we're going to pass this Obamacare, and if you like your existing plan, you can keep your plan. Meaning that the Obamacare law would not affect your care, your current plan. So for those of you who have been kicked off your plan, and he says it's 5% of Americans, 5% of 300 million people is enough to sway the next election. And I believe this is going to be a turning point in this whole, well, it's already been a turning point in the whole love fest for Obama. It's obvious that the Democrats passed Obamacare in the middle of the night. Nobody read the bill. It's a bunch of garbage. And Americans are getting screwed, every one of you. And, you know, let's name some of the things that Obamacare is known for, people say it's good for, right? You can stay on your parents' plan up to age 26. Most plans that I know allowed that, most, in the past, okay? But if you're up to age 26, you're usually in school or you're working. And if you're working, usually you have coverage. And if you're in school, you usually have coverage from the university. It is a modest plan, but it will cover scrapes and scratches and even probably broken arms. All right, the one that I had in college was very limited. But when you're in your 20s and 30s, most people are invincible. They feel invincible. And getting them to buy healthcare when they don't need it is ridiculous. It's ridiculous, okay? Even women who have health issues, in the past, I've known them to go to free clinics and get their care from other places. And it's usually not that expensive. Even if they went to Planned Parenthood for the annual checkup down there, or to get their birth control pills or whatever, Planned Parenthood was not that expensive. So that's the other thing. Okay, stay on your plan until you're 26. Can't be denied coverage because of pre-existing conditions. I agree with that. You know, I worked for a company once, and the company changed plans. And one of my coworkers' wife was pregnant. Under the old plan, they were covered. Now we were talking to the new representative, and she said, "Oh yeah, we're going to have to get a special exemption for your wife because pregnancy is considered a pre-existing condition." Now they got the exception because it was a corporate plan. Like 100 people are going to be covered under the new plan. So of course, if this company wants the new business, they're going to accept this woman and cover her for being pregnant. So I don't see that as being a big issue, okay? But certain other pre-existing conditions, yeah, it's wrong. It's been wrong for companies to deny you for coverage. That's a cool thing. But those two things could have easily been legislated to say, hey, all new plans need to offer that and that, right? Easy to do. Don't need Obamacare. The third thing was what? I can't even think of it. People said that it was so great. This is unscripted, people, so I have to think. What was the third thing? I don't even remember. But again, no caps on coverage, right? That you can't have a cap on coverage. So like if you really got hurt and needed a lot of specialized care, sometimes there's like a $100,000 cap or $500,000 cap on what the insurance company would pay. I sort of agree with that, right? There probably should be some kind of a cap to protect the insurance company. But of course, the insurance company will negotiate with hospitals and pay X number of dollars for whatever surgery. Now, did you ever go to an emergency room and you had insurance? Because I did that once. I went to the insurance room with my child, my baby girl. She had an ear infection. I didn't know. She just kept crying, and she was, you're a parent. You care about your kid. You want to get some help. I went to the local emergency room. They checked her out. Took about 10 minutes. Said she had an ear infection. Gave a prescription for that pink stuff, that antibiotic pink stuff. And that was it. Now, I told them, hey, I have insurance. Here's my insurance card. Oh, no, we don't need that. We just need your phone number. What? Based upon my phone number, I got a bill for $270. I said, what the? Why didn't you tell me before, right? I sent this to my insurance company, and they paid $75. My insurance company said, hey, $75 is what this should cost. I received one more letter saying you owe whatever, 175 minus 75, $200. And I refused to pay. And they went away. All right. Now, another thing that he says in this thing is people had bad Apple plans that either made them go bankrupt or didn't provide enough coverage. Okay, fair enough. But then he says, for those people who couldn't pay their bills, everybody else paid for them. So what's the problem? You have insurance, it pays X amount of dollars, whatever's not being paid is paid by everybody else. That's the old plan. And now the new plan is what? I need to pay for stuff that I don't need. I don't need maternity care. I'm not a woman. A woman over 55 probably doesn't need maternity care. Why would you make her pay for that? But on the other hand, if you're an insurance company and you see that the woman is 55, probably she won't get pregnant. And you probably don't need to charge her extra for maternity care because she'll probably never use it, right? most insurance companies probably will charge. And that's the problem. Or mental health care. If you are known not to have any mental health issues, why would you want to pay for that? I don't need that coverage. I don't need that. Like when you know, it's just weird. Now, most people have, if you have a car, you have automobile insurance. It's required. What comes with automobile insurance? Healthcare coverage, right? In an accident. And usually the coverage is pretty high, you know, $1 million for injury, medical injury to yourself, $1 million for if you hurt somebody else. So even under the old plan, if you had a car and you got hurt or sick, could you not say I had a car accident and hurt myself and be covered under your car insurance plan? I don't know. I guess it's passé now, right? We don't have to worry about that. The big lie, though, right, is what he said. Under the old plan, you could keep your plan with Obamacare. Now he's saying that Obamacare, the law, now that it's passed, means you can't keep your old plan that you liked. And that is not what he said when he was pushing Obamacare. That is absolutely not what he said. This is a huge lie, a big lie. Now, what's the solution? Let's talk about solutions, people. Now, I don't know if you're going to be able to do this, but this is just what I would do if I lived where you live in the United States of corruption. Healthcare. Other countries offer healthcare that's very affordable. I'm not just talking about Canada. Maybe you could get a plan in Canada that would be cheaper. I don't know. Never used a Canadian system. Don't know how good it is. But I have used the Polish system here in Poland. Yeah, Central Europe. That's right. That's right. Poland. And if you just do some simple research, I'm not going to promote any particular company, but there are many private insurance companies in Poland. And Polish private insurance is relatively inexpensive because there is socialized medicine. Socialized medicine is such a bad word. It's not. You guys already have socialized medicine. It's called Medicare. Look at your pay stub. If you're working, you pay 3-4% to Medicare. And what does that go for? It pays for old people who are covered by Medicare. And hopefully in the future, you'll be covered by Medicare too. That's socialized medicine, folks. You guys already have it. Here in Poland, it's a similar kind of deal. You work, you pay into what's called ZUS. It's an insurance program and retirement. And that covers everybody who's working and the elderly who are retired, and children are covered by the public system. Now, you may be thinking, oh, that's the public option. I guess. Now, I've only used the public system once. It was for my son who had something under his eye. We went to a public hospital, and I was scared at first because it was literally full of old, possibly sick people. Older people get sicker more often because they're old. And I walked in there and I thought, oh my God, we're going to be here for hours. It's never good. We're never going to see a doctor. Literally, there was like 100 people sitting around this hospital clinic. My wife checked us in, and I guess because we had a child, I sat down and I was really irritated. But within 5 minutes, they call our name. We go there. They check out my son. They say, oh, it's just a little pimple or something. They pop it. We're out. That was it. It's covered because he's a child and he is covered by the Polish system. Pretty nice. But the reason why private health insurance in Poland, I believe, is reasonable is because of that public system, the public option, right? I have the option to wait for a public doctor, or I could buy private insurance and see that same doctor under a private system, because it's the same doctors, folks. Same doctors work in the public sector as work in the private sector. Sometimes they work, 3 days a week, 3 days a week there, or they work the morning shift in the hospital and they work the night shift or whatever, the afternoon shift in the private place or whatever. But it's the same doctors. You see what I'm saying? It's just a question of how fast do you need the care. I'll give you an example. My father-in-law hurt his back. Contacted the local doctor, hospital, whatever. They said he'd had to wait 2 weeks to see the doctor. I also hurt my back. I have private insurance. I called up, got an appointment the next day. Now, here's what I wanted to enlighten you people about. If the numbers, the prices that you see or that I'm hearing about, they say it's anecdotal, but if you're paying like $2,000 a month to have health insurance under the Obamacare plan, and you're a family of 4, you make $50,000 a year, that is insane. That's half of your income going to have insurance. And then they're saying that these plans, $2,000 a month, whatever, they also came with a copay of $12,000, which means you wouldn't get any benefit until after you spent $12,000 out of your own pocket. That's the copay. So in addition to paying $24,000 a year for the insurance, you'd have to spend another $12,000 a year, which is 24 plus 12, $36,000 before you got any benefit from that plan. Now, if that is true, or if it's anywhere close to what you would be having to pay, let me give you this option, this idea. I don't know if it's possible, if it's legal. Pay the $90 fee or fine for not having some approved plan in the U.S. and buy yourself a plan here in Poland. And for less than $12,000, you could fly your whole family to Poland twice a year and see a doctor here. Right now, how much does insurance cost here? A family of 4, I was paying 608 Polish zlotys, which is at today's exchange rate about $200 a month. $200 a month, folks. That was a silver plan. It included everything: general doctors, specialized doctors, ambulance service. There was a 500 zloty copay for any admission to the hospital, which again, it's about $150 to be admitted to the hospital. After that, you're covered. You're not paying anything else. So, that is a comparison. Compare that. Same doctors, same medical programs, different, they didn't go through the USMLE. They didn't have to take the USMLE, right? Exams. They're not certified in the US, but they are certified in the EU, in Poland. And a lot of these doctors have studied or done residencies in the US. Listen, folks, I'm just trying to say, wake up. This is a huge, huge lie. And if the Tea Party was ever a threat to the Democrat Party, they're very not democratic. Democrat Party, Obamacare has got to be. And if people are really hurting, as we are hearing the reports now, can't even get coverage, can't even get on the website, and when they do get a quote, it's insane. How is that good for America? How is that good for the American people? It simply is not. And there's got to be a better way. And I think the better way is going to be a clean sweep of the Senate and the House in these midterm elections so that Obamacare can be eliminated and maybe cherry-picked. The best aspects of the plan be cherry-picked so that the American people are better served by the medical establishment. That's my take. I would love to hear your comments down below. It's Holy Joe, rock and roll, coming to you live and unscripted. Oh, why am I wearing this tuxedo? Because, as the joke says, if the president wants to be impotent, he should look impotent. Peace out.
I hate commuting to the city. I hate commuting to the city.